A heavyweight fight right now seems to be underway between the president and state leaders over who has authority to reopen parts of the country. That as the White House is set to announce a new task force focused on that mission. Sinclair's chief political correspondent Scott Thuman shows us the latest from Washington.
So you actually had a hard time breathing?
Oh yeah, I was afraid for my life.
President Trump today meeting with recovered coronavirus patients.
Do you feel you're as good as you were before this happened?
Yes.
The number of those treated and now doing well may factor into the president's desire to reopen. But who makes that decision is at the heart of a brewing debate. More than a half dozen governors in the Northeast and several out west are banding together to help reach a conclusion. But President Trump has insisted he is in charge.
His proclamation is that he would be king. That's what a king is. A king has total authority. That statement cannot stand. The whole mutiny on the bounty, the governors are mutineers, whatever that means.
He's referring to the president's tweet today. Tell the Democratic governors that Mutiny on the Bounty was one of my all-time favorite movies. A good old-fashioned mutiny every now and then is an exciting and invigorating thing to watch, he tweeted, especially when the mutineers need so much from the captain. Too easy. Some say a power struggle isn't needed, just an understanding.
The best way to deal with this is locally. You know, every city is different. Miami is not New York. New York is not Oklahoma City. You know, all the cities are different. They have different densities. They have different topographies and different climates.
Perhaps clarifying matters just a bit, President Trump this afternoon said his decisions will be made in conjunction with, and he reiterated that phrase, in conjunction with the governors and what he called other talented people. He said those decisions will be made quickly.
Back to Blaine County, where by the end of this week, antibody testing for the coronavirus will be taking place. CBS 2's Scott Logan tells us how it came to be one of the first places in the country to do this.
In a pandemic, it pays to have a sister who is an epidemiologist. Ketchum Fire Chief Bill McLaughlin in hard-hit Blaine County reached out to his sister, an epidemiologist in New York State. That set the stage for Blaine County to be one of the first places in the country to use antibody testing for coronavirus rather than the basic swab test.
We hope that eventually it may tell us whether or not people will be able to develop immunity, and possibly as well whether or not they can donate plasma for helping other people fight off infections.
Local leaders also hope antibody testing will eventually provide answers as to when people can resume normal activity. All that's left to do is get federal approval of the testing protocol, and Chief McLaughlin says that could happen as soon as the end of the week. The chief says the community is not letting down its guard despite some good omens.
You know, we have definitely seen a flattening of the curve. Instead of having 50 people showing up at the hospital each day, we're having, 2 or 3, and that is a big improvement.
But like everybody else in the country, indeed the world, the chief wonders if this trend will hold.
You know, at its peak, the Democratic presidential primary had a field of 27 candidates. Now that field is effectively down to 1. And today, the most popular Democrat in the country bestowed his formal endorsement to that one candidate, the last candidate standing. We go inside the Beltway now to Sinclair national correspondent James Rosen, who's got details.
Former President Obama's endorsement of his loyal vice president provides a much-needed jolt of news energy for the candidacy of Mr. Biden during a pandemic that has largely shifted national attention away from presidential politics. But it certainly didn't come when Mr. Biden could have used it most urgently. In a video posted Tuesday afternoon, Mr. Obama said his fellow Democrat possesses knowledge and experience, honesty and humility, empathy and grace. And without ever naming President Trump, the former president cast Mr. Biden as better suited to tackle today's major challenges.
That's why I asked him to implement the Recovery Act, which saved millions of jobs and got people back on their feet. Because Joe gets stuff done. Joe helped me manage H1N1 and prevent the Ebola epidemic from becoming the type of pandemic we're seeing now.
With the departure last week of independent Senator Bernie Sanders from the race, Mr. Biden stands as the presumptive nominee. It marked an extraordinary, if not unprecedented, comeback for the former VP at a time when many pundits had written him off. An endorsement early on from former President Obama might have eased Mr. Biden's path. Stephen Levingston, author of Barack and Joe, The Making of an Extraordinary Partnership, told Sinclair last year that the two politicians have always had a complex relationship and one that is still evolving.
Well, at heart, it's a political marriage, and it always was a political marriage. It became something more, and we all watched how it became something more. The photos didn't lie, the video we saw of them having a good time together, that's all true.
At this moment, Mr. Biden stands 698 delegates shy of the number needed to clinch the nomination. More than a dozen states and territories have delayed their nominating contests, and the Democratic Party has pushed back its national convention 5 weeks until mid-August. Reporting from outside the nation's capital, James Rosen.
Idaho healthcare professionals are working day in and day out to help patients. CBS 2's Haley Kramer talked to a doctor at Saint Alphonsus in Boise who is directly working with COVID patients in ICU.
How are you holding up, and how are your colleagues holding up?
Good question. My life has changed, as has everybody's, drastically.
Dr. Meghan Mcinerney is a pulmonary critical care physician at Saint Alphonsus and already spent most of her time working with patients in the ICU.
In the ICU, we are so used to taking care of really sick patients. However, that's usually in the context of having a lot of evidence and medical literature and studies and years of experience to go on. This is different because we're all learning from each other in a very short period of time.
They're doing their best to learn from their colleagues on the West Coast, the East Coast, Italy, and Spain.
We've had the benefit in Idaho of having more time than some of these other places. And so I feel like things are calming down a little bit for me, at least. I feel a little bit more settled because we have a really good plan in place. And if the surge comes at a later time or at a different time, I feel like we're ready.
How has it been on the emotional side, seeing patients? Obviously, it's very different because they don't have the support of family members around them when they're going through this.
I'm a daughter and a sister and a wife and a mom. And if any of my family members were in the hospital and I couldn't be with them, it would be devastating to me. And so I think all physicians and nurses and respiratory therapists, all of us at the bedside feel that. And we are trying the best we can to support our family members, by calling them. Some colleagues are even doing video, chat so they can see them. It is hard and it is very different. But I've said this before, as difficult as it is an essential intervention.
When it comes to resources and staff, Mcinerney says they have what they need.
We are working really hard at making sure that our PPE can last as long as possible. Learning how to reuse PPE. There's been a huge learning curve for how to reuse, how to clean PPE.
Mcinerney says healthcare workers will continue to take care of COVID patients, and they need everyone to do their part.
This is real, and even if we're getting to the point where we're starting to flatten the curve, that this is going to be a continuing issue for a period of time. This is not going to be over in just a couple of weeks.
Haley Kramer, CBS 2 News.
And tonight we're getting a good look at the state's medical supplies stockpile that includes personal protective equipment, or PPEs. CBS 2's Erica Lee has more on the governor's stockpile tour and how long the supplies are expected to last.
Governor Brad Little says Idaho has enough personal protective equipment for healthcare workers, but is still working to secure more medical supplies to be prepared for the future. These are the current numbers of supplies received for gowns, face shields, gloves, coveralls, N95 masks, surgical masks, and safety goggles. According to Little's office, there are enough supplies in stock to meet the projected demand for another 2 weeks. However, Little says there's still more we can do to flatten the curve.
We need to do more testing, and to do more testing, I got to have more PPE. We need to make sure that our first responders, police, fire, ambulance drivers, that they have an adequate inventory of PPE. Given the fact that there's still community spread, we've lowered that community spread, which is our goal. But to make sure that our healthcare providers and our first responders are safe, we have to have personal protective equipment.
During a teleconference with AARP today, Little and health officials also answered the community's questions about coronavirus.
The simple metrics is I got to have enough healthcare capacity to where if you get sick, even without COVID-19, you can get into the hospital. If you get sick with COVID-19, will there be treatment there that will save your life? And that's the most important thing. And if I did nothing and let it run like it has in some countries and even in some areas, the negative consequences for the economy would be greater. So we have metrics, and there will be some of them introduced tomorrow in our executive order. But this is because it is so new, the science, the epidemiology, the virology is so new, there are just a lot of moving parts.
Little says he will address more in his executive order announcement tomorrow morning. Erica Lee, CBS 2 News.